5,600 studies, turmeric more effective than leading drugs for diabetes, arthritis, cancer, and more. Turmeric comes from the root of the curcuma longa plant and has a tough brown skin and a deep orange flesh. Turmeric has been used for generations by Chinese and Indian populations as a powerful anti-inflammatory and medication. Fun fact: turmeric was traditionally called Indian saffron because of its deep yellow-orange color and has been used throughout history as a condiment, healing remedy and textile dye. Turmeric has a peppery, warm, and bitter flavor. Although it has a mild fragrance similar to orange and ginger, it is best known for its usage in curry. It also gives ballpark mustard its bright yellow color. Turmeric is one of the most thoroughly researched plants in existence today. Its medicinal properties and components, primarily curcumin, have been the subject of over 5,600 peer-reviewed and published biomedical studies. One 5-year-long research project on this sacred plant has established over 600 potential preventive and therapeutic applications, as well as 175 distinct beneficial physiological effects. Given the large amount of research completed on this versatile spice, it is no wonder that a growing number of studies have concluded that it is comparable to traditional pharmaceuticals. Antidepressants, Prozac/Fluoxetine and imipramine. A 2011 study published in the journal Activebeat Pharmaceutica found that curcumin compared favorably to both drugs in reducing depressive behaviors. So basically turmeric is an all-natural alternative to big pharma drugs. This is good for two reasons: 1, it's natural and better for your body and the environment. 2, it's cost-effective. Cholesterol medication, Lipitor/atorvastatin. A 2008 study published in the journal Drugs in R&D found that a standardized preparation of turmeric is comparable to the drug atorvastatin, also known as Lipitor, on endothelial dysfunction. What's that, you ask? It is the inner lining of blood vessels that drive atherosclerosis, a disease of the arteries characterized by the deposition of plaques of fatty material on their inner walls. It is also associated with reducing inflammation and stress in type 2 diabetes patients. Steroid medication, corticosteroids. A 1999 study published in the journal Phytotherapy Research found that the saffron-colored pigment in turmeric known as curcumin compared to steroids. It compared similarly in the management of chronic anterior uveitis, an inflammatory eye disease. A 2008 study published in Critical Care Medicine found that curcumin compared favorably to the corticosteroid drug dexamethasone and an alternative therapy for protecting lung transplantation-associated injury by regulating inflammatory genes. An earlier 2003 study published in Cancer Letters found the same drug also compared favorably to dexamethasone in a lung injury. Ischemic perfusion. Inflammatory bowel disease, IBD. People with digestive and stomach issues are most often intolerant to medical intervention, because the stomach is already compromised and drugs literally tear up the mucosal lining. Multiple studies have reported that many patients who suffered from IBD, Crohn's disease, and ulcerative colitis were able to stop taking their prescribed corticosteroids altogether because their conditions improved so rapidly with curcumin. Many patients with IBD reduce their pain symptoms with corticosteroids, but damage the intestinal lining over time. If you didn't know already, that's not a good thing. Supplementing with curcumin increases the growth of probiotics and anti-inflammatory properties, while avoiding all the harmful side effects of pharmaceuticals. Blood thinner, aspirin. A 1986 study published in the journal Arzneimittelforschung found that curcumin had antiplatelet and prostacyclin modulating effects when compared to aspirin. This indicates that it may have value in patients prone to blood flow obstructions, vascular thrombosis, and who require anti-inflammatory therapy. Anti-inflammatory drugs. A 2004 study published in the journal Oncogene found that curcumin was an effective alternative to the drugs aspirin, ibuprofen, sulindac, phenylbutazone, naproxen, indomethacin, diclofenac, dexamethasone, celecoxib, and tamoxifen, in exerting anti-inflammatory and anti-proliferative activity against tumor cells. Arthritis management, diclofenac sodium. Curcumin is well known for its powerful anti-inflammatory and pain-reducing properties. A study conducted on 45 rheumatoid arthritis patients compared the benefits of curcumin in turmeric to arthritis drugs. Arthritis drugs often put people at risk of developing leaky gut and heart disease. The study split the patients into 3 groups: curcumin treatment alone, diclofenac sodium alone, and a combination of the two. The curcumin group showed the highest percentage of overall improvement. Their results were significantly better than the patients in the diclofenac sodium group. The curcumin treatment was found to be more effective, and did not have any negative side effects. The results of this study, published by Phytotherapy Research, has encouraged more human research to evaluate the amazing effects curcumin-rich plants like turmeric, and its effects on people suffering from various types of arthritis. Chemotherapy drug, oxaliplatin. A number of studies on cancer cells have shown curcumin to have an effect on cancer cells. It seems to be able to kill cancer cells and prevent more from growing. It has the best effects on breast cancer, bowel cancer, stomach cancer, and skin cancer cells. A 2007 study published in the International Journal of Cancer found that curcumin provided similar results to oxaliplatin, chemo drug, as an anti-proliferative agent in colorectal cell lines. In normal people terms, that means the curcumin works to block cell rejection and supports immune suppression regimens. Diabetes drug, metformin. A 2009 study published in the journal Biochemistry and Biophysical Research Community explored how curcumin might be valuable in treating diabetes. The findings showed that curcumin activated AMPK, which increases glucose uptake, and suppresses glucose production in hepatomas cells in the liver. Hold on to socks for this bomb. Curcumin was found to be 500 times to 100,000 times more potent than metformin in activating AMPK and its downstream target acetyl-CoA carboxylase. Painkillers. One of the more widely accepted properties of curcumin, in scientific communities, is its ability to manage pain. The European Journal of Pharmacology discovered that curcumin naturally activates the opioid system in diabetic rats. This is the body's natural pain-relieving response, typically manipulated by drugs. Burns. There really is no limitation to the positive health effects of curcumin in turmeric. One study claims that burn victims, treated by dangerous opiates, and non-steroidal anti-inflammatories, should be treated with curcumin instead. The U.S. Army Institute of Surgical Research suggests that curcumin is better than conventional burn medications. So what's the takeaway from this article? You can basically treat any illness with the curcumin in turmeric. And why not? It's more natural and cheaper than traditional medications.